This is part of the Ask Me Anything series about COVID-19. I'm with Dr. Anna Kauffman, a family physician who practices in Bluffton, Ohio. Why would healthy kids have to wear a mask that lowers their oxygen levels and increases their CO levels?
It is worth noting that this does not happen. There are multiple examples of medical personnel demonstrating that oxygen saturation levels are not modified by wearing masks, even as many as 6 masks. I regularly wear an N95 mask with the exhalation valve covered by another surgical cone mask all day in the office without ill effects. It is easy to confuse carbon monoxide, or CO, and carbon dioxide, CO2. Thankfully, the former, which is highly toxic, is not a byproduct of human respiration, so would not be an issue at all. Some slightly higher levels than baseline levels of carbon dioxide can be detected between mask and face, but the concentrations do not rise to dangerous levels. It is worth noting that the higher the concentration, the more osmotic pressure would push to reduce the concentration of carbon dioxide within the mask. Oxygen molecules are much smaller than the virus and able to penetrate both masks and mask borders effectively. The SARS-CoV-2 virus, or the virus that causes COVID-19, is between 60 and 140 nanometers in size. Oxygen is less than 0.3 nanometers in size. In other words, the virus is between 200 and 468 times the size of oxygen. Imagine for a moment that the virus that causes COVID-19 is enlarged to the size of a football field. This is a pretty terrifying thought experiment, but bear with me. If the virus is the size of a football field, oxygen would be about the same size as a football. As you can now picture, it's definitely possible to block the virus without blocking oxygen. And it's also really hard to argue that masks are ineffective at blocking the virus, but block oxygen. So yes, healthy kids should wear masks because they could be asymptomatic spreaders, passing a lethal virus to other kids and teachers.